Thank you, Tammy, and I'd like to welcome everyone to today's session with ICMA. And it's very timely, I guess, as a topic, and for a number of reasons. May is traditionally Mental Health Awareness Month. And so we're in kind of the beginnings of May. It's also unique in that this week, the 15th, is always Police Officer Memorial Day. And so it's kind of a double awareness month or event month. And one of the challenges that we've seen this past year, at least in working with cities, with city managers, with police, fire, EMS departments, and communities as a whole across the United States, has been the effects and the challenges of dealing with COVID-19. We've had almost a year of being separated from people, that we've had to isolate, that we've encouraged people to work at home, to do Zoom meetings like this, where you're doing sessions, to do other events and conferences. We've done them from the comfort of our home, or I guess in some cases, bedroom, or wherever we're at that we're tuning in. But it's been a year of separation, and that's difficult and it's hard on people. The other challenge that we have with mental health is, especially in cities and in local government, it's something that we don't like to talk about. There are a number of factors why we don't. We're going to cover those today. Helaine Zack is going to be joining me for this session. Helaine does counseling with the Michigan Management Association, or Michigan Municipal Executives, I have to get that right, MME, and it's the Michigan chapter of city management. And so she works with managers, but as managers, and just a little bit about my background, I began in the fire area, moved to police, never really knew if I worked my way up or down, became director of public safety and ultimately city manager, retired after 16 years and moved to Washington, where headed up the Commission on Fire Accreditation, moved to ICMA in 2008, and then we spun off into a standalone group in 2015. But during that time, I've had the opportunity, to work with other managers around the country, and it's a challenge for managers, because if you talk about it, if you admit it, many times you can find yourself isolated or separated for a number of different factors. Just a little bit about the Center for Public Safety Management. I'm not going to go in, because today I'm kind of coming from a different position. I also, 4 years ago, was ordained as a priest in the National Catholic Church of North America. So I kind of hold a double duty, that not only am I a former city manager, but I'm an ordained minister. And so for today, I guess I'll take off the black shirt, open collar, and put on the closed collar. But when we talk about mental health, when we talk about suicide prevention, because we're seeing an increase, and I'm going to talk about that a little bit more, we really need to look at the problem. And there's a ton of research. There is a lot of resources out there. If you're being challenged, if your staff are feeling challenged, if you're dealing with issues surrounding mental health or suicide prevention or depression, there are a lot of opportunities to engage folks that know a lot more than I do. That's why I have Helaine here, because she knows a heck of a lot more than I'm ever going to be able to cover. But there's a lot of research out there that points to a number of the factors why certain things occur. We're also going to talk a little bit about prevention, and in particular, what you can do. And that's a significant piece. All the research shows that intervention and taking a direct approach is the best way to deal with these issues. Too often we say, well, they're just having a bad day, or I don't want to talk about it, or that just makes me uncomfortable to talk about it. And so we avoid it. The best thing you can do as a manager, and I'm not sure what all the titles are, I haven't seen the registration here, but the best thing you can do is to confront people, to ask them directly. That is the best way to approach it. What's the scope of the problem? Well, the problem is significant enough that May is Mental Health Awareness Month. that we have an entire month dedicated to dealing with mental health issues and awareness. In 2021, the theme is "You Are Not Alone." And how appropriate for this year coming out of a pandemic when, I talk to folks, I do a weekly mass, I talk to people, and that has been the hardest thing about the pandemic is being alone, that people don't have a support group, or they don't have anybody with them. I live in a condo building in downtown Washington, D.C., a few blocks from ICMA's headquarters. And there are a number of older people in my building. There are 379 condo units. There are a number of people that have been alone the entire year. And I've made a point of trying to reach out and talk to them. Some were only comfortable in dealing this way or via email. I can't imagine what that's been like for a year of not having contact. They had deliveries made to their door. You walk through the building, you'll see those folks. They have everything left at their door. They open it up. That's going to be a significant factor, not only for our staffs, but our communities as well as we come back online. I was just talking to someone this morning, and I said, have I eaten in a restaurant in the last year inside? It turns out I have actually about a handful of times, not quite even on a hand, one handful, and it's all been fairly recent. But just the thing of going out and having dinner with folks, going to an ICMA conference, going to a regional session, doing anything together, your state associations, whatever. We just haven't done that. We haven't had that opportunity to gather. So the theme of "You Are Not Alone" probably couldn't be better for this year. When we talk about suicide, it's a health issue and it can be prevented. That's the big factor. It turns out that the suicide rate was actually on a downward trend. It's going to be interesting what happens over the next couple of years as people begin to re-engage. But there's some things with mental health and suicide do's and don'ts. The first thing when you're talking about suicide, we try and avoid things like committed suicide or mentioning a failed or a successful attempt. The terminology that all the professional groups pretty much have moved towards is died by suicide or ended his or her life. And that it's death by suicide or they died of suicide. And it's that change in language that they didn't necessarily commit it. It wasn't an act that they thought through. But when we look at that on just the scope, and I've had to talk to a number of managers this past year, one of the things that I've been engaged with is the American Foundation for Suicide Prevention, which has a chapter in pretty much every one of your states. First thing I'm going to tell you is go online, find your local chapter. There are a ton of classes, programs that most of them have moved to Zoom, that if you've had an employee that has either suicided or attempted, that there are resources out there. And don't forget the people left behind. But it's a huge problem. 800,000 people across the world, every 40 seconds. It's the leading cause of death in a lot of populations. And for everyone that is successful, there are 25 attempts. And so it impacts communities, it impacts workforce. It is a significant issue across the board, just economically. It's about a $69 billion impact. Your police officers. One of the challenges that we've seen this past year is in policing. One of the factors that we're seeing coming out of the pandemic is the ability to even hire replacement officers who are taking the place of retirees or people that have chosen to leave the profession. It's becoming a crisis. And while the exact numbers are still coming in, last year, more police officers died from suicide than were killed in the line of duty. That's a huge number. That's a significant number and a significant problem. And if you look at it, most police, my son is in the Army. One of the things that we talk about the Army themes and their commercials are an army of one. Most of our police forces we look at as an army of one. They function alone, they work alone, they don't have that support. And so it's a big problem to the point that there are a number of organizations through IACP, through the Police Officers Association, Blue Health is one that has been reaching out because the deaths have increased from about 143 to 228 in 2019. More, like I said, more were killed than would be usually included on the wall at the police officers memorial. 2000, the 15th of May is always Police Officer Memorial Day, and there are a number that go unreported. Um, if you need resources, if your police department needs resources, or you want to share and have these are free. They're from the COPS office. You can go online, you can download them. One of their hottest publications right now is law enforcement officer suicide. That is one of their hottest topics, one of their hottest downloads right now. But mental health and awareness is one of the second ones that are coming up over and over and over. It's been a challenging year for police, and don't let them feel like they're left alone. Law enforcement agencies kind of get it from every which way. They have to deal with the situation many times. They're dealing with the public. They're right now kind of under attack from a lot of directions, and oftentimes they don't feel comfortable seeking peer support. Most agencies that we talk to, and we go into probably 40, 50 a year cities, they have employee wellness programs, they have counseling, but many people feel uncomfortable doing that because are they going to be buttonholed? Are they going to be looked over for promotions? Are they going to be, frozen out of advancement? Are they going to be just talked about behind their back in the organization? When they turn around and see people going, is that going to be for them? And again, for their family and support. Fire is another area. USA Today reported that 103 firefighters were killed in 2017. That actually has increased now in 2019. Again, more firefighters, almost twice as many are dying from suicide as died in the line of duty. We're also seeing that in EMS. And if you think about EMS, it's really been a challenge for those folks. Hospitals are another area. If your city is a municipal hospital or you have a role in that, studies this week came out, and almost a third of the medical team, their staffs, are burned out or looking for other jobs. Actually, it's about 2/3 are burned out and are showing some kinds of PTSD. That's a big issue. The International Association of Firefighters have started a program dealing with that in behavioral health. Do you have a veterans population in your community? Do you have veterans on your staff? They're seeing a significant increase in suicides and calls for mental health. Many of the homeless that we deal with regularly on the street are veterans, and the rate was running about 20 a day from suicide. It's up to about 22. And so that's a significant problem. If you're a military town, if you have a high veterans population, do you know where the resources are? Do you know what you can do or do your staffs to help? Again, we're losing 20 to 22. There are veterans crisis hotlines. There are a number of places that they can go. Again, the AFSP, the American Foundation for Suicide, the national group, there's usually a state organization, and many communities have their own. In DC, I'm active in the DC chapter. There's also one in Fairfax. There's one in, I think it's Montgomery County has one. Virginia has one, Maryland. So there are a lot of different chapters that you can reach out to. Do you have an LGBTQ population? One of the leading causes, it's actually the second leading cause of death of young people ages 10 to 24 is suicide. Again, this affects your staff, affects community groups in your area, the homeless population. All of those things have increased as a result of the pandemic. We're seeing a lot more people on the street that maybe have been pushed out of housing or stable home environments. The good news is in 2020, September 2020, President Trump signed the National Suicide Hotline Designation Act. It actually is 2020, it says 2019, that's when it was introduced. It actually passed in 2020, but it creates 988. Just like 911, there is now a number you can call when you're in crisis. I've worked the line, I've actually taken calls at different times and helped people. If you're looking for an area to volunteer in, there are usually hotlines in communities, and they're always looking for volunteers. I've found it extremely rewarding. The time to get upfront and personal is it can affect anyone. suicide prevention, and this is the 2018 walk for suicide prevention. They usually have overnight and they have local walks that raise money. But a national walk, the overnight has gone virtual the last 2 years. But when I say it can affect anyone, in May, actually 5 years ago this week, I came home and my partner had suicided. I found him, attempted to revive, and unfortunately, he did not survive. But one of the things that are kind of used at the suicide prevention walk, and these are a number of different colors of beads, but one of the things that I wear today, and when I go to the walks and participate, are the red beads, and it signifies a loss of a spouse or a partner. And unfortunately, I have that group that I became an unwilling volunteer. I guess not unwilling, but it wasn't something that I looked to ever want to join. And the colors that you'll see at the national walks, usually there's 4,000 people at the cities that they choose for the national walk, and they're all wearing the beads. They have it's called a bead ceremony, and you'll see people. I've met them from around the country and around the world. People that have lost a child, or lost a parent, lost a spouse, lost a sibling, which is orange, lost a relative or a friend, lost a responder, which is silver, just a supporter of suicide prevention, wears blue, or that has struggled or attempted and worn the teal color, or that have a personal struggle and they wear green. And sometimes you'll see people with, basically all of the different colors they'll be wearing that they've been impacted by suicide. A year after my husband died, my best friend, she actually did not show any signs. Neither did Barry, but in her case, she had been undergoing some treatment for another medical issue, and they changed the medication, which they feel reacted, and she overdosed. And so it can impact a lot of people a lot of different ways. These are just the colors. One of the things that you can do to start a discussion is just post the colors. Encourage people to talk about if they are having problems. I'm going to turn this over to Helaine now, and she's going to look at it from the mental health aspect. Helaine?
Thank you, Tom. Okay, so let me tell you a little bit about who I am. I'm a social worker by training, and my field of expertise has been employee assistance programs, taking care of employees and their family members for years. I had the wonderful opportunity to work closely. I did employee assistance programs as an external provider, and I think I serviced about 8 or 10 different city governments that included city managers, police, fire, so forth. And from that, I got this crazy idea as a champion for mental health. I ended up running for county commissioner in one of the large counties surrounding Detroit. And I served as a county commissioner for 18 years, 9 terms. And again, the purpose of why I ran was to be a voice, particularly on mental health and health issues. Mental health issues run in my family. I have my oldest daughter has bipolar disorder. We've had life, death situations. I can gratefully report that she's turning 40 and living a successful life in Los Angeles as a motion graphic artist, managing her bipolar disease, and been through a couple of suicide attempts in our world. So it's very painful. I also, at this point, I was trained to do trauma intervention, something called critical incident stress debriefing in the 90s. And it was originally a modality to help emergency service workers normalize and stabilize after traumatic events. So I continue to do this intervention now as a consultant for a lot of different employees. And unfortunately, suicide, mental health and suicide are far too common, and they do impact workplaces. I also, as Tom, I am the counselor for the state of Michigan. We call it the Manager in Transition program. So what I say to all of us is we're all human. We all have life events that are stressful. Stuff, I call it, whether it's COVID and all the complications, aging parents, partners with mental health issues, substance abuse, whatever. So it is commonplace that we all live with it. I know as city managers and leaders, you also have a double whammy because you are not only you're responsible for managing your city government, managing your employees, taking care of, services for residents. So you have a big responsibility there. And so that stress, I just plugged in, that stress can be very challenging for all of you. So why we'll get referrals into the Manager in Transition program when managers are going through particularly stressful events. Sometimes it's job transition. I understand as a former elected official, you can have crazy elected leaders, change in, elections, things like that. Sometimes it can be unprecedented change, so forth. So I will work with these city managers or city personnel that are referred to me to help them through that transition piece. And any type of change is a type of loss, and it's a grief process. Whether it's a good change or not, you're still going through a grief process. So what my message to all of you, understanding the life we live in, all the responsibilities that we have, I really focus in on taking care of ourselves. And I like to, my, modality, what I say is I have my own stress management toolbox, and I encourage all of you to develop or identify what are the tools in your toolbox to take care of yourself first. For example, when 9/11 happened, and that was a life trauma crisis for many, for our country. I remember running around my workplace trying to get information. It was a very stressful day for all of us, anxiety. I could not wait to go home to get on my treadmill and run it out like a gerbil. All of that anxiety, all of those issues that I was feeling is one tool in my toolbox. Exercise helps calm me, normalize, stabilize me. I love to garden. I can't necessarily garden in Michigan in January. And so it's a wonderful tool in the summer and nice months when I can garden, but that tool doesn't necessarily work for me in January. So I have a whole list of things that I encourage all of you to be aware of, the tools in your toolbox, practice them so that you don't feel that you're anywhere near depressed, thinking about suicide or doing something, that is not healthy. Regarding the toolbox, okay, part of it is also practicing it. I've had people say to me, I say, they say exercise really helps them. And I ask them, when did you last exercise? And they'll tell me 2 months ago. So you need to practice that. Other things about tools is that anything in moderation is okay if it is calming, healing you. But if you have to go home and have a beer or a glass of wine tonight, fine. But if you have to go home and drink a 12-pack to normalize and stabilize, then you're not using that particular tool moderately. Another thing that I want to remind you, the metaphor of when you're on an airplane, the oxygen mask comes down. What do they tell you to do? They tell you to put the mask on yourself first and then take care of the people around you. I understand that all of you members on this call are used to taking care of others. That's who you are, that's what you do. But I also am saying to you, you really need to take care of yourself. Put the oxygen mask on first. Finally, I want to talk to you about, the issue of suicide, the issue of these human issues. It is, what I would say to people in employee assistance programs, it is appropriate for you as city managers, if you supervise people and you see change in behavior, things going on with that employee, it is appropriate for you to send them for some counseling. Send them to your employee assistance program, your wellness, your community provider. Often people need that little nudge to get them there. If you have colleagues, I call these peer referrals. I care about you. You don't seem like yourself, and encourage them to, seek help before we're talking about such an extreme point of suicide. One of my favorite, when I worked with this one city, I had this captain of a police department that became my buddy. And he used to send his people to me all the time. And it was wonderful because that personal touch, and they were gentle referrals, he sent people early stage of issues and we could intervene more quickly before it became the point that they felt so bad that they want to do suicide or more harmful behavior. So you aren't getting in somebody's business, you're leading them to the professionals that can help take care of them. So I'm open to questions. I'm going to turn it back to Tom.
Okay. One of the other resources that I wanted to point out was the National Alliance on Mental Illness, excuse me. It's called NAMI. And again, on their site, there are a lot of different resources that you can look at. But one of the things that, as we look at mental health and mental health issues, there are signs and there are things that we should be watching out for. I can tell you that I was trained as a police officer. I was trained in a number of different areas. I, received religious training and everything else. I did not see the signs. Sometimes they're difficult. They're easy to overlook. People will oftentimes tell you, "Oh, I'm okay. I'm just having a bad day. You'd be better off without me." There are warning signs that I've learned since having to go through that, and I encourage you to engage your staff, to encourage them to just go and do some reading and see. But there are 10 different warning signs that NAMI points out. Excessive worrying or fear. If anybody has gone through this past year and has not had worry or fear, they're probably superhuman. We didn't know what was going to happen some weeks. I know I had a couple of friends, one who was an acquaintance in Michigan, a manager who passed away from COVID. There were worries and fears. I still had to do a little bit of traveling. I also, lost two of my siblings and had to go back and do their funerals. And that was worrying for me. And so again, was it excessive? No, but I know the difference and know that if you have staff that are worrying more than perhaps normal or whatever, feeling excessively sad, feeling excessively low, confused thinking or problems concentrating and learning, extreme mood changes, including uncontrollable highs or feelings of euphoria. And I can tell you that was one I missed on my partner. Prolonged or strong feelings of irritability or anger, avoiding friends and social activities. We've encouraged people to avoid those this past year. So getting back into this is going to be probably a challenge for many people to have to suddenly go out and engage with the public again. I still walk on on the other side of the sidewalk when I approach people. How long is it going to take us to kind of unlearn some of the things that we've done? If I saw Felicia Logan on the street, I'd probably have to do an elbow bump. Back when we worked together, I would have laughed and we would have probably, given each other a hug or whatever. Those type of things are going to be things we need to be aware of as we come out of this pandemic. Avoiding friends is certainly one that I've seen this past year, where people just suddenly ghost or cut off, different people. Difficulties understanding or relating to other people. Changes in sleeping habits or feeling tired and low energy. I've talked to one, and I've probably talked to 1,000 people that have had issues with that this past year. Changes in eating habits, such as increased hunger or just lack of appetite. Changes in sex drive. Difficulty perceiving reality, that they become delusional in some cases. The inability to perceive changes in one's own feelings. Overuse of substances, like Helaine mentioned, alcohol or drugs. I love my doctor because he takes a holistic view on things, but he encouraged me when my cholesterol had gone up that it is okay to enjoy a glass of red wine every day. A glass is okay. The whole bottle or the case is probably too much again. So in moderation. Multiple physical ailments without obvious causes, sudden headaches, stomach aches, ongoing aches and pains. For me, that's called getting old. But again, those are warning signs as you're talking to people that say they're thinking about suicide or about just ending it all, or I just want to go away by myself. Those are things that people begin to say. The inability to carry out daily activities or handle daily problems and stress. They suddenly break down. Do they suddenly get very angry? Those are warning signs that we need to be aware of. An intense fear of weight gain or a sudden concern with appearance. My husband was a stylist. He did Miss Maryland and a number of different star or pageant star hair. And that was a sign I missed. Suddenly began letting himself go and wasn't taking care of all of those things. Those just in and of themselves doesn't say, boy, somebody didn't get up and comb their hair today. But again, it could be something and a warning sign. For your children, changes in school performance. I have 4 beautiful granddaughters. They manage pretty well to get online every morning at 9 and do Zoom school, and they do Zoom cheerleading and everything else. I don't know how they do it, but it's been a challenge for a lot of kids. A lot of kids feel cheated, like they've lost part of their life. They lost prom, or they lost sporting events, or they lost graduation last year. Graduate. Again, excessive worrying by children, anxiety, fighting, avoiding going to bed, or not wanting to go back to school. I have a feeling we're going to have some kids that are going to have a real hard time wanting to go back to school. Hyperactive behavior, frequent nightmares, frequent disobedience or aggression, frequent temper tantrums. Those are warning signs and symptoms. And again, we all have bad days, but they're things to watch and things to tell people it's okay to talk about it. Many of you might have heard the presentations that we've done, and one of the groups that I work with ICMA and for ICMA is it's called Project ABLE, which is active bystandership for law enforcement. One of the things in Minnesota of the George Floyd incident is there were a lot of people that were trying to engage, that were trying to stop the behavior that was taking place. We have 4 police officers there. And the ABLE project kind of became much more powerful and much more of a dynamic across the country, because one of the things that we found is that many departments have policy on active bystandership and peer intervention. We don't train people. And it was shocking to me as I got involved with the group, and I've gotten to meet with Dr. Irvin Traub, and he's a survivor of Auschwitz. And so he has studied human behavior for decades. And his impetus or his focus was, why did people stand by and let things like that happen? And one of the reasons is we don't train people how to intervene. We don't, we spend a lot of time sending them out to the firearm range. We send our firefighters out to spray water, to do hose lays. We don't train people how to actively intervene. One of the most successful campaigns that have ever been run in the country was the Friends Don't Let Friends Drive Drunk campaigns. Number one campaign for bystander intervention. And it was successful because it encouraged and trained people how to say, you know what, Helaine, you shouldn't probably drive today. I'll give you a ride home. Or Helaine, why don't you give me your keys? I'll drive you home. Or you look really tired today, Helaine. I'm gonna make sure that I get you home. Why don't you ride with me? We'll leave your car here in the parking. You engage the person, you engage your friend so that they don't do something that's harmful. And we don't train with it. And we're actually very uncomfortable with it. The ABLE project, I think, has now trained 395 departments across the country. They're actually training as we speak the entire New York City Police Department on how to engage. And it's interesting as you talk to police officers, because they'll tell you, you know what, I've been a police officer for 30 years, 40 years, and I've gone to all kinds of things. And I've gone to firearms training, and I've gone to breathalyzer training, and I've learned all the defensive tactics. No one ever told me, no one ever challenged me and helped me to intervene, to actually know of how to have bystander intervention. And so it's something that we need to do more of. We need to engage. Right now, that program is only available to law enforcement. I suspect it will expand. It came out of actually New Orleans. New Orleans has been doing it for 5 years, I believe, that they've been engaged. And they've seen significant changes because they were under a federal decree for having issues. And it's made such a change that now it came out, it's been expanded. Georgetown Law Center here in Washington, D.C. took it on as a project. It's attracted the attention of a number of different funding organizations, PepsiCo, MasterCard, lawyer groups, and the Department of Justice. And so it's something for your police officers. The good news about that for your police is that's free. They actually train the trainer. They've been doing it all by Zoom. New York City right now is doing it live. And in person, they've got 35,000 officers to train. But they've been doing it by Zoom. It turns out it's been a phenomenal success, and the officers actually like it. And it's gone over very well. Again, a free resource for your police department that you can go onto Georgetown Law under ABLE, and you can find that out. Again, the EMS, the IFF, all of those resources will be on this PowerPoint at the end. And so we encourage you to look at those different things. But we're going to take a little break here. I'd like to make sure that we get all the questions that you might have, or comments or anything else. We've got about 20 minutes. We've got more, and you'll get a copy of the slide deck here. It has a lot of information in it, but I want to make sure that we leave time for you to ask questions, because this is your session. So if anybody has questions, you can type them in the chat. You can raise your hand, and I've got to remember how that if you raise your hand, I can see that. But again, feel free to type them in the chat. I mentioned research. Don't forget that if there's a loss, and this covers if someone in your organization, if someone in your family, if a friend, there are stages of grief. I can attest to this. I went through these. I can attest that the people I've had to work with over this past 4 years now, that I've counseled, that I've actually encouraged them not to go through with instance and help them get help. But there are stages of grief. Don't forget people that are left behind in your organization. Again, with the mental health and with these things, we don't. But we avoid people, or we don't say things. But again, people go through shock. I don't remember the first week. I can tell you right now, I don't remember. I've talked to people and they said, oh yeah, we're chatting. You answered my phone call when I called you. I don't remember it. I have no recollection. You go through a denial. You go through anger. You go through bargaining. You want that. You make all kinds of deals with yourself and different things. You go through depression stages yourself. You go through testing. And the good news that I can tell people, that you do get to a point of acceptance. You do get to the point, and one of the big ways that I found to get there was doing just this and talking, reaching out, being engaged, sharing the story. That helped me deal with the loss I went through. It wasn't easy. I can tell you the first few times I wanted to run and hide. I wanted to cry, but there were issues that you have to work through, and talking about them. And that's why I say with your staff, don't avoid them. The tendency is when they come back to work, we won't talk to them because they went through a loss. The best thing you can do is engage them. Don't make them feel like they had a double loss. Helaine?
We have a couple of questions in the chat
Okay.
that I think we need to address.
Okay. What's the best way to ask if someone is feeling deep depression or the COVID could care less?
Do you want me to address that as the
I'm going to
social
let you do
worker?
that. I'm
Okay.
going to let you do that.
Okay. So having worked with lots of different employees, and often, seeing signs is the change in behavior. And so what are you seeing that you think that they're dealing with COVID or having depression, or what are you hearing? And so to have that care and concern discussion with that employee. I care about you, Sally. I see that your work performance, I see you stressed, observable, measurable behavior to address that, okay, in that way, not diagnosing, oh, you've got depression, but things that you're recognizing and asking them if they want to talk about it. So if you are their supervisor, part of your tool, can you do it as part of job performance? Are you counseling them on that? Is it impacted? And you're strongly encouraging them to get help, and you need to have some type of number to call, whether it's your employee assistance, whether it's NAMBI or community resources, something to hand them. And then if they have strong job performance issues, you can try to mandate. You can never force anybody, but you can say, I'm really concerned about your job. I really want you to talk about it. Also, normalizing this particular depression is treatable disease. It's not a stigma. It's not mental illness. It's treatable disease such as diabetes, and really to normalize that so that people don't think that you're going crazy. So does that answer, did that answer your question on that one? Tom, do you have anything to add to that?
That the biggest thing is to talk with people. And if you notice them quieting down or the symptoms that I mentioned, don't be afraid to ask, to say, Helaine, what's going on with you today? That one of the things I learned in preventing suicide and working with people is that's the first thing they teach us is how to be upfront. Uh, what we're taught to do, and again, this is a free class. Most of your AFSP chapters are doing them. They're doing them by Zoom. Is to ask and say, Helaine, are you thinking about suicide? And it's amazing because I've had to do it 3 or 4 times now, and people will look at you and say, yeah, I am. They're a little surprised that you see it. And then you have to ask and say, how were you thinking of doing it? Do you have something you're thinking? One case, they told me they had been stockpiling pills. They had thought it through. And so I had to accompany them over to their house. I called a friend who was a police officer. We went over and we intervened. We called a family member, got them home. Another case, we took them to the emergency room. But it's that direct intervention, again, that we don't often do.
But you got to be careful as a work, if you are the
Right,
employer of record.
right.
It's one thing in the community, but if you are the manager, supervisor, city manager, you can't necessarily do that directly with your employee. And you can't ask them if they have a suicide plan. You could get
That
workplace issues.
exactly. Well, and that leads into the next question. How do you get people to seek help? As I mentioned, police officers often are asking for help. It's a sign of weakness, and or they feel like they're going to be pigeonholed. I'm going to be overlooked for a promotion because I admitted I was depressed, or I couldn't handle. In law enforcement, we say, "Oh, I couldn't handle the situation," or whatever. There are a lot of those stigmas. One of the things that I found worked really well is if you haven't got a chaplain corps in your city, reach out to your local ministers in your community. They are a great resource. Hey, they're looking for people to come to church, especially after COVID. They're going to be looking for a lot more people to come to church, but they'll volunteer time and they usually love engaging the people. They'll come along, right along. Part of it is building trust. They have to have trust that what they say isn't going to come back up. As Helaine mentioned, with the employee wellness programs, that's the most frequent criticism we hear. If I call the EAP, are you going to call Helaine up and tell her that I just came in and got treatment? No. So you have to build that trust in your employees that, it's okay to ask for help. It's okay to talk. That's where I know the chaplains that I've seen a couple times that I've done it, you're talking to people and they begin sharing. And again, the nice thing with when I have my collar on is there is no expectation I'm going to share anything. Um, the confessional is sacred, but again, you've got to build that trust. Do your employees even know you have an employee assistance program? Do you bring those folks in to do presentation? Do they know your employees? Do you have other areas, Helaine, that you saw that work well?
I want to add, so you always want to stress the confidentiality of seeking help. Assure people that, it's not going to hurt their job in any way. When it comes to police officers, that peer referral, do you have some identified peers in your department that can help encourage their officers to seek help? Or that really friendly captain that cared so much about his people and they respected him? And he sent me a lot of his officers. He was really special. And do you have that peer referral? Also, have you identified a treatment professional through your employee assistance, through your community, that really specializes in law enforcement? And are they received in that unique piece? And I had to carve out what I called my preferred provider treatment providers. I had a colleague friend when I used to do trauma intervention that was a former firefighter turned social worker. And he was one of my best resources because he walked the walk. And so do you have those identified people to receive that referral of your public safety, your police, your fire too? But again, those peer referrals are really, really critical to the success, and destigmatizing that they are going to be harmed in any way. Confidentiality.
And if you have a critical incident in your community, have a critical incident stress debriefing team or whatever you want to call it. Make sure you take time. I remember when we had one case, a lot of the older guys will sit there with their arms crossed and we're okay, we don't need to talk. And as the counselor began working and just listening, we had one, he was probably a 35-year-old police officer, suddenly broke down crying. Did not expect to see that. He sat through the entire thing like this, with this gruff look on his face and wasn't going to, to share anything. And she was able to be non-threatening and work with the group of what was bothering them. I can tell folks that one of my first calls that I went on was a little girl was hit by a car. I can still remember her face, and that's been 40 years. I can remember her face, everything about her. I can remember her blue eyes looking back at me and everything else. In those days, we didn't do critical incident. You came back and you're expected to be tough. You don't need to talk about that. Go do the report. What the heck, Casper? You got 2 other calls waiting for you. Make sure you take time for your people. And again, that goes a long ways to them seeking help if they do have a problem. If you say that everything's always okay and that you're weak or you're somehow defective or you're somehow there's something wrong with you because you say, I want to talk about something, it will succeed itself. And so again, make sure that you're having critical incident debriefings. If there's a shooting in your community, a fire, one of the things that I've seen, we actually had a fatal fire once. We did the debriefing, but I lost 2 volunteer firefighters. That it was a child that died in the fire. They couldn't have saved her. We did the debriefing, but they came in after the debriefing and said, you know what? It's okay for us to say this, but we can't do this anymore. And I respected that. That was something that they had to do. But don't overlook those incidents, even when people say, oh, I'm not. Well, that's okay. Things come up. And so again, building that rapport, it's building that trust that it's okay to seek help. And you have to have that in the organization.
So I want to just talk quickly about employee assistance programs. And as one of these people that goes out to workplaces all the time since the 90s, I had an episode recently that a company had of record an employee assistance program. There are different style employee assistance programs, and some have resources that you want, have the critical incident stress debriefing available. I'm encouraging to make sure that you have effective benefits and resources as part of your organization. Some are not very user friendly, and that's why I got called in through, again, Mark Wallenweber, through my manager and transition thing, he knowing that I do this and that I could help out this organization. So I do encourage all of you to take a look at what are your benefits, what are your resources that are available to you should you have some type of crisis event. Unfortunately, shootings are too common right now. Or critical events, so just are you prepared and ready?
And I know what, and I just looking ahead at some of the resources I put at the end, but I'll also post up. There is a group, if you're for police, just dealing with police crisis, and it's out. They've got quite an active program in the Dallas-Fort Worth area. They work with police specifically, and they also work with the EMS in that area, the MidStar ambulance. That they've developed a program that they work one-on-one with those officers and EMS in that area. And they just changed their name. That's why I was looking at it. It used to be called K22, and they just are rebranding, and I can't remember what their new name is. I'm drawing a total blank right now, but we'll provide that information to you. But as Helaine said, having people that have walked in their shoes is important. in a lot of cases, because that opens the door up. That, you know, I've been there, I've done that, I've had to, you know, live through it. And sometimes that's what it takes, is just having that ability to develop a rapport. Any other questions? I think we did really, really good.
I would just want to say thank you, everybody, for attending, and hopefully you're taking something away with you. And thank you to my co-presenter, Tom, for sharing your story and all the information that you give to many people out there.
Well, and in the slides, the thing is, there'll be information in some of the groups, and I'm looking with the prevention and talking about it, but things that you can share. And again, there's a hotline. Don't be afraid to post this, you know, and have it. Make sure that people are aware. Now it's 988. There's crisis lines, and I don't have the latest one for the police, but I'll make sure that I include that with the group and what they form. I know that they're working at expanding and dealing with police, because it has been a stressful year for police in particular. And so they've seen a record number of calls for help. And so with that, do I turn it back to Felicia, or do we Logan taking the call back? Oh, the recording will be available. Will be posted on ICMA Connect.
Yeah.
And the presentation will be, I was just telling them, Felicia, that where it would be available, it's on ICMA Connect. And you'll receive a copy of the slides and the information. Feel free to share. If you have questions, you could reach out to either Helaine or I. We'd be happy to point you in the right direction.
And thank you so much, Tom and Helaine, on behalf of ICMA. This was a wonderful, heartfelt, important conversation to have. And that's one of the reasons we invited you to come and be part of the critical conversations, because the more we talk, as you said, the better things will be, and the sooner we can help people get the assistance or be open to talking about mental health. So I really appreciate both of you. Thank you so much. And as Tom said, the recording will be available on ICMA Connect, and I would bet it will be on there by no later than Monday. So thanks again for joining.
All right, thank you.
Thank you.